This episode is brought to you by Neurocrine Biosciences. Thank you, Neurocrine, for helping NADF continue to educate, bring about awareness, and save lives. Welcome to All Things Adrenal. Each episode, we'll hear stories from individuals living with adrenal disease, share updates on treatments, research, protocols, interview medical professionals, and explore all things adrenal together. I'm your host, Vanessa O'Rourke, NADF Community Engagement Manager and fellow adrenal warrior. Today, I'm thrilled to share that we have our first guest joining us for all things adrenal, Dr. Smita Abraham. Dr. Abraham is an academic endocrinologist with a special interest in adrenal and pituitary disorders, including, but not limited to, adrenal insufficiency, congenital adrenal hyperplasia, primary aldosteronism, pheochromocytoma, and Cushing's syndrome. Dr. Abraham has conducted research in many of these areas and is currently conducting a study to redefine the cortisol cutoff level within the cosyntropin simulation test to more accurately diagnose adrenal insufficiency. Dr. Abraham practices endocrinology part-time at Montefiore Medical Center in Bronx, New York. Needless to say, she's an extraordinary medical professional. Thank you, Dr. Abraham, for joining us.
Thanks, Vanessa. I'm really happy to be here to talk about the adrenal glands today.
So let's start at the beginning. I know when I was diagnosed with Addison's disease, I had absolutely no idea what the adrenal gland even was. So I think it would be fantastic if you could walk us through the basics and explain, what do adrenal glands do?
Very good question to start with. So what do the adrenal glands do? The adrenal glands are small triangular organs that sit atop each kidney. And the adrenal glands make substances called hormones. And these hormones have many different roles in the body. The inner part of the adrenal gland, called the medulla, produces something called catecholamines. One of those hormones you might be familiar with is called epinephrine, or even more commonly called adrenaline. And catecholamines are responsible for the body's fight or flight or stress response and also help to regulate blood pressure and heart rate. The outer part of the adrenal gland is called the adrenal cortex, and it produces multiple hormones, but three main hormones. The first is cortisol, the second one is aldosterone, and the third is sort of a class of hormones called sex steroids. Cortisol supports the body's metabolism, for example, like blood sugar balance. It also supports immune response, helping to maintain blood pressure, helping to maintain electrolyte balance, like sodium and potassium balance, and helps the body with its stress response. Aldosterone is responsible for salt and water balance in the body, and thus also helps to maintain blood pressure. And then sex steroids are responsible for the development of secondary sex characteristics, like the initiation and ability of a person to go through puberty, and then maintaining a healthy reproductive system throughout their life. I also want to note that the hormones I've described are some of the main hormones produced by the adrenal glands, but the adrenal glands actually produce a bunch of other hormones as well. In addition, these adrenally produced hormones all work together. They all work with each other, the cortisol, the aldosterone, the sex steroids, the catecholamines, and they also work with other hormones produced elsewhere in the body. And together, that helps to maintain a healthy and balanced mental and physical body.
I'm so glad that you mentioned that it works with other aspects of the body, because I think, first off, it's so amazing how this organ is so small, yet it can do so much, but it also is connected to everything. And so now that we have a better understanding, and thank you so much for breaking that down a little bit, I'd love if you could share, how does the adrenal gland interact with the rest of the body?
Right. So these hormones, they basically all communicate with each other. And the hormones attach to various what we call receptors. It's sort of like opening a door. I come knock on the door, communicate my message, you take the message and go on to do other things with that message. So those hormones get released into the bloodstream, and then basically they go all over to the different parts of the body, the brain, the heart, the gut, the liver, the kidney, and they're all talking about what needs to be done. Hey, do we need to increase the blood pressure? Nope, we're good. Oh, the blood sugar is a little low. We need to increase it right now. So they're all working together, communicating with all these different, blood cells, other organelles, organs, etc.
I'm glad you said the door analogy too. My brain initially went to a phone, like thinking telephone that you played as a child, and how when you're all sitting in a line, the message starts here, and through each person, the message gets lost. Well, if you pull a person away, they can't pass the message on. And that just made me, connecting. If we're not being able to communicate these hormones, the message to the body is not being distributed.
That's exactly right. That's exactly right.
Okay, so let's say the adrenal gland is not producing a sufficient amount of hormones. And what are some of the symptoms if they're not producing a sufficient amount or just stop producing altogether? What would that patient experience?
Right. So just to sort of start with a baseline, the adrenal glands, just like everything else in the body, can unfortunately be affected by various disorders. And so when an adrenal gland disorder occurs, it can either create a problem where there's too little of some of the hormones that we just mentioned. And sometimes there are situations where it's producing too much, and we'll go over both of those. So let's talk about when it's not producing enough. We call that condition adrenal insufficiency. Adrenal insufficiency is primarily associated with too little cortisol production. Now, there are two types of adrenal insufficiency, and depending on the type, the production of aldosterone and sex steroids can also be affected. Now, in general, regardless of which hormone, cortisol deficiency or low cortisol is always a part of adrenal insufficiency. However, aldosterone and sex steroid deficiency are not always there. That said, symptoms of adrenal insufficiency, very much related to low cortisol, include nausea, vomiting, lightheadedness, weight loss, low blood sugar, low blood pressure, weakness, and a lot of people feel extraordinary fatigue. Now, a lot of us are just fatigued every day. We have a lot going on in our lives. But the fatigue associated with adrenal insufficiency is a little bit more, a little over the top, something that, people just can't keep up with. If someone also has aldosterone deficiency as part of their adrenal insufficiency, they can also experience low sodium in their blood, and they can feel very thirsty or crave salt.
Yeah, I can attest to all of those symptoms. I had all of them prior to my diagnosis, and even now when I'm low cortisol, that fatigue that you talk about, it is such a word that's thrown around, nowadays everywhere in medical professionals and
Everywhere.
in people. And it really is a totally different type of fatigue. It is not tired. It is the best way that I've described it, or that I feel I can describe, is like I feel like I've been hit by a train. My body is like my body weighs thousands of pounds. Just to lift up my hand is so exhausting. And I don't really know how you can share that with someone unless they've been through it. I don't. I appreciate that you understand it because it is something that I
Yeah,
feel like so many people don't recognize.
I agree with that. I think it's important when you're speaking to your physician or you're speaking to whomever and trying to figure out what's going on, to sort of really sort of unpack the word fatigue. You know what I mean? Because people, especially with, what we call primary adrenal insufficiency or Addison's disease, really do. Like, I've heard more than once the same analogy. Like, I just feel like I've been hit by a Mack truck. Like, I
Mhm.
cannot move. It's that kind of fatigue. So yeah, no, I think that's really really important to highlight.
Do you think there's another vocabulary word that would be more like received better by medical professionals, like depleted, or is there something that you think would be a better? word to use?
Um, I wish there was. I think it's a little bit of a back and forth between the clinician and the patient to sort of really define fatigue. I think it's important to say sometimes when I'm in the room with a patient and doing an evaluation, I sort of say, do you feel like tired? And I kind of make a point to say, well, not just tired, because a lot of people feel tired, but do you
Mhm.
feel just so fatigued, so bad that you sort of can't get up? And I do say the words like, do you feel like you've been hit by a train or hit by a
Mhm.
truck? Sort of to really hammer the point home that this type of fatigue is not your usual, "Well, I just didn't get enough sleep and I've been so busy," and that does help in the evaluation. Then they say, "No, no, I'm actually not that. It's not that bad." So
That's
I
good.
think just
Yeah.
really driving that home.
I think that's really helpful because a lot of people are nervous or don't know exactly what to say to their medical professionals or how to get their attention about certain things. But another thing that just popped in my mind too that it's so bizarre, but when I'm that tired, when I'm that low cortisol on the verge of a crisis, I my mouth is so heavy. I can't keep my mouth closed. Like it takes so much
Mhm.
energy to close your mouth, which is not something I think about on a day-to-day basis, but when I'm low
No,
cortisol,
yeah.
it like falls and I am like drooling and I'm like, "Oh, I am in trouble right now." Like that is how tired I am. I can't keep my mouth closed.
Yeah, yeah. So I think the symptoms also that we're talking about, um, and I know we're not going to talk about this too much, but I do, we talked about the fact that there are two types of adrenal insufficiency and what we call primary adrenal insufficiency or Addison's disease, where the adrenal glands just don't produce any hormones, period. People with that type of adrenal insufficiency tend to have worse symptoms and
Mhm.
some of these sort of more severity of the symptoms than people who have sort of the other type, which we call central, because some of those people still have a very little bit of cortisol production left.
So those individuals with adrenal insufficiency with primary or, with adrenal insufficiency in
Mhm.
general, when they do need to updose their glucocorticoids, specifically hydrocortisone or prednisone, their replacement steroids, when they need to updose when they're under stress, why does that happen? What such as from illness or from flu, why do they need to updose? If you could explain that, I think that would be really helpful for people to hear.
Yeah, no, absolutely. So let's start with when somebody has adrenal insufficiency, sort of regardless of the type, the main hormone that you're missing that must be replaced is cortisol. And we replace cortisol by giving people what we call steroids. Okay, that's sort of the type of the name of the medication, the generic name. And that steroid could be hydrocortisone. And hydrocortisone, the pill, hydrocortisone pill, it is exactly the same molecule that our body produces when the adrenal glands are working normally. And so it mimics cortisol exactly. There's another type of medication called prednisone. That's what we call a synthetic or sort of, factory made, not factory made, but man made perhaps steroid that people also take because it also has the actions of cortisol, but it's not exactly the same molecule that our own body produces. But both are very good medications. So when you have adrenal insufficiency, it's important that you're sort of taking that steroid. Usually we give a dose in the morning and a dose in the afternoon, but sometimes it could just be in the morning. It's very specific to the individual and how they feel throughout the day, and the timing of the medication should really optimize how they feel all day. So it's really important that they take those every day because taking that steroid helps your body, function properly. Because as we mentioned, cortisol has a lot of different roles in the body, and you need those steroid pills to help continue and maintain those functions. We mentioned that one of the functions is that cortisol supports a healthy immune system. And so when you don't have the cortisol, your immune system is a little bit confused. The cells don't work quite right. They might not communicate properly. And importantly, when you get sick or when you have an illness or a significant stress, Normally, what happens is cortisol helps your immune system rise to the occasion, if you will, and help
Mm.
fight off that stress and help trigger other hormones to fight off that stress and, keep you going through this difficult period. So when you don't have that cortisol, those things don't happen. And then the stress or the illness starts taking over because the body can't fight it. So we need to give the body more cortisol during these times in people who have adrenal insufficiency. And we do this by what we call stress dosing. And at home, this can be done by doubling or tripling the regular daily dose of the medication that the person is taking for at least the length of the illness. Or sometimes we, have taught patients how to give themselves or taught their family how to give them a steroid injection if you have a particularly severe illness. And that injection can be given at home. Sometimes people have to go to the emergency room for, intravenous steroids. But, our whole point with the National Adrenal Diseases Foundation is really to educate people who have this illness to be able to do a lot of this at home so that they can avoid, going to the hospital. So just to quickly, I hope it's okay. I want to just really talk about what happens when you sort of don't stress dose.
Please do.
So, if what happens if a person with adrenal insufficiency does not stress dose during an illness? Well, again, that cortisol deficiency makes it a lot harder for the body to fight infection, and it can lead to something that we call adrenal crisis. And that is just a very severe state of adrenal insufficiency. And that illness or that virus is like really kind of winning and taking over because there aren't enough immune cells working properly to fight back. And so, what can happen is the person can get very low blood pressure, a lot of body aches and pains, maybe feeling dizzy or faint, feeling confused, some belly pain, maybe even fever. And at that point, when you're on the verge of an adrenal crisis, some people sort of know how to manage what they're feeling and they can take enough pills to help calm that down and get to a stable state, and then sort of like continue stress dosing to get themselves out of it. Some people, if they're too far gone, they have to get that injection, that steroid injection, either given if they are with it enough to give it to themselves, or have a family member or a friend give it. And we try to tell everyone who has this that, when we prescribe the injection, it's really important that you learn how to give it to yourself. And it might almost be more important that a family member or friend be taught how to give it also, because when you're on the verge of an adrenal crisis, and I don't have to tell you this, Vanessa, like you can't, you're not, it's kind of hard, unfortunately,
Hmm.
we're not in a position where we have something like an EpiPen where we can just quickly inject, but you have to like take the syringe and, like pull the solution out and put the powder in and da da da. It's, it's quite a process. So having some assistance with that is really, really helpful. And then for anybody who can't give the injection, doesn't know, doesn't feel comfortable, it's really important to go to the emergency room so you can get that intravenous steroid dosing, get some fluids. I also want to point out the things that might, you know, put someone in this position. And I think, a lot of people with Addison's disease sort of do get to know themselves and what triggers
Hmm.
them. But if you don't, then it's important to remember that sort of taking your medications every day, sort of taking them on time, staying hydrated really helps to prevent adrenal crisis. And then understanding that if you do have an illness, if you're under severe emotional stress, if you know your triggers to updose or stress dose in that time. And then the other thing is, it's important if you're getting prescribed new medications by your physician to ask them, like, well, is this medication going to interfere with my hydrocortisone or prednisone? Do I need to take more or less or whatever? So, all of those things are important to consider to help avoid adrenal crisis. So I really would encourage, all persons with adrenal insufficiency to please speak with your doctor, whether it's your primary care physician or your endocrinologist, to sort of make sure you have a plan for stress dosing. And then, Vanessa, as you know, on the NADF website, we have a lot of instructions. On YouTube, there's tutorials for how to give the injection, etc.
I think it's so important to cultivate a plan and prepare prior to needing it because as
Yes.
you said, when you're in that state, you know, honestly, I think the most important thing is to tell those around you, friends, family, coworkers, even if you live alone, like let somebody know and you can text them and they know whether it's a word or a phrase that you might need help because you know, I don't want to generalize, but I can say from my experience, my cognitive levels are so low when I'm low cortisol. I don't even think sometimes that I need to stress dose. I mean, here I am working with NADF. I educate patients about this all the time. I know this and I plan about it, but even when I'm experiencing it, it's very hard for me to go through the steps because cognitively, the cortisol is just not there and I'm not thinking correctly.
Yep.
So it's
Absolutely.
so important to make that plan, to educate other people, to practice, 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 because that's what can save your life or someone's life.
Absolutely. I could not agree with you more.
Okay, so I mean, I could talk about adrenal crises for 100 years, and, I'm sure we'll focus on that at some point in the podcast. But while we have you here, we've talked a little bit about, those that can't produce this cortisol or underproducing. But what about those who are overproducing the hormones? What are some of the symptoms that they might be experiencing?
Yeah. So when the adrenal glands overproduce hormones, they usually do it like one by one, although sometimes you can be in a situation where two hormones are overproduced. But the majority of the time, we see that the adrenal glands sort of overproduce one hormone at a time. And it's because there's this sort of naughty group of cells that have grown in the adrenal gland that are just don't behave and don't follow, the regulation and the signals of when to be high and when to be low. And they're just constantly producing the hormones. So Cushing's syndrome or Cushing's disease is a disorder of too much cortisol. And symptoms of Cushing syndrome can include rapid weight gain, new onset or worsening of diabetes or high blood pressure, easy bruising, muscle weakness. It kind of becomes hard to get up out of a chair. Some people who regularly brush their hair, all of a sudden, it's like hard to lift your arm up and brush your hair. And then they experience mood changes that are sort of, again, more significant. I mean, everybody has their moods and they kind of go up and down, but they may feel much more pronounced in the setting of too much cortisol or Cushing syndrome. Now, if you have too much aldosterone, that's called hyperaldosteronism. And that one doesn't have really as many signs or symptoms. The most common one is really new onset or difficult to control blood pressure, especially at a young age. As we've learned more about it and are screening more people, we are finding it more commonly in all ages. But again, it's the new onset high blood pressure or very difficult to control blood pressure. And about a third of people have low potassium in the blood, but not all of them. And then the last one, which is these are sort of the three overall more common disorders where we have overproduction of hormones, but albeit all of these, generally speaking, are kind of rare in the general population. But the last one is called pheochromocytoma. And that's a disorder of too much catecholamines, or in the beginning, we talked about catecholamines or epinephrine or too much adrenaline. And so that happens, those symptoms can include also difficult to control high blood pressure or these very unusual, distinct episodes of your blood pressure shooting up high and then coming back down. Some people paradoxically can have like low blood pressure spells, and a lot of people have headaches and sweats. So those are some of the common symptoms of, I would say, sort of the three more common disorders where hormones are overproduced by the adrenal gland. But again, I say more common in the sense that they're common sort of to us as clinicians.
Mm.
They, in terms of sort of an incidence and a prevalence rate, are not so common in the general population.
So either way, I mean, I'm going to kind of overview this, but these tiny little jelly bean organs on top of our kidney are either can be producing too much, so over communicating to the rest of the body, or
Mhm.
they're under communicating to the rest of the body. But either way, the message is making a huge impact on the entire system and dysregulating it and changing it.
Absolutely. Absolutely. People with these disorders don't feel well, whether it's too low or too much. They feel pretty crummy. So thus the importance of, the diagnosis and treatment of all of them.
So then let me ask you this. Let's say someone who's listening is experiencing some of these things. They don't have a diagnosis yet. They maybe don't even have an endocrinologist yet, or someone they know has these symptoms. What would be your advice to them? What is the next step that they should do if they're experiencing either, too much cortisol or hormones or too
Mhm.
little? What should they do?
I mean, the best thing really to do is, either to start with a primary care physician, or if you feel strongly you can, and your sort of healthcare situation or insurance allows for it, you can go directly to an endocrinologist. Because if you go to them and specifically say, like, I have these symptoms and I'm sort of concerned that I have adrenal insufficiency, or I'm concerned that I have Cushing's syndrome, or I'm concerned that I have, high aldosterone, then, it does help the physician to sort of say, okay, like, why are you thinking that? And it opens up the discussion. And for all of these disorders, we have screening tests that can be done very easily. So whether it's through primary care or directly through an endocrinologist, say, I was listening to this or I read about this online and I'm very concerned about it because I have XYZ, and so, and then the doctor, whoever doctor it is, can sort of help, either reassure and or start a screening investigation, and or if, depending on what the symptoms are, send to an endocrinologist.
Yeah, that's great. I think it's so important to emphasize the empowerment that patients should have to take control of their situation and their symptoms, because no one has to live in your body but you. So if you're feeling something and it doesn't feel right, investigate it. It does take a lot of work and time and energy. I mean, I spent years trying to figure out what was wrong with me. And here I am. It's not like everything's perfect right now in my health journey, but I'm so glad I invested and I didn't give up and I continued to go to doctor to doctor to doctor with my binder of symptoms, because it did help me get an answer. Because everything that you've talked about, once we have a diagnosis, we can have a plan and a treatment in order to function in a new way.
Right. That's right. You kind of have to reach a new normal. And like you said, I think it is true for most people with any of the deficiencies, or the excess syndromes, it is kind of a health journey. A lot of investigating in the beginning. Our goal really is, as we educate patients, as continually educate clinicians, is to get to a diagnosis faster, in those who have it, and get to treatment faster. I mean, it may not be a perfect treatment for each person, but it's better than not having the treatment.
I couldn't agree more. Having an answer and a direction is a starting point, and then you can kind of navigate from there.
That's right.
Well, I just want to say thank you so much, Dr. Abraham, for joining us and sharing your time, energy, and expertise on this episode of All Things Adrenal.
It was a pleasure to be here, Vanessa. I really hope that when people hear this, that they find it educational and helpful as they sort of figure themselves out. So thank you again for inviting me to join. I really appreciate it.
Of course. Thanks for being here, Adrenal Warriors. I'm your host, Vanessa O'Rourke, sending you all the spoons, and I hope you have a wonderful day. Thanks for joining in on another episode of All Things Adrenal. This episode is edited and produced by Magdalene Zinke. For more information on the National Adrenal Diseases Foundation, please visit nadf.us. If you're listening on Spotify or Apple Podcasts, please leave us a rating and review to help others find out about all things adrenal. If you have a story you want to share or a question you'd like answered, reach out to NADF support at nadf.us.